I'd like to introduce the 2012 Better Government Competition Award winner, entitled A Recommendation to Coordinate Care Management for Medicaid and Medicare Beneficiaries. The 2012 Better Government Award winner deals with two major entitlement programs, Medicaid and Medicare. Millions of Americans are eligible for each program, and about 9 million people are eligible for both programs. The fact is, those 9 million people often receive subpar care because the programs are siloed. Also, the cost of care for these so-called dual eligibles is extremely high. We can do better. I'm pleased to report that the Patrick administration has announced that it's moving forward with a reform for Massachusetts that is based on the recommendations included in this year's winning proposal. Here to tell you more about their paper are co-authors Robert Helms of American Enterprise Institute and Grace Marie Turner, the president of the Galen Institute.
Thank you so much, Shani, and thanks Jim and the judges of the Better Competition Award program. This is a huge honor. We are really in awe. Bob and I haven't had a chance to look at the other 200 entrants, but I think the fact that you had at the Pioneer Institute so many submissions with so many good ideas shows the incredible amount of energy that's out there to really move toward the principles that the Pioneer Institute stands for of limited government, market principles, and more efficient government to make sure that the services that are being provided are actually getting the taxpayers' dollars, getting value for the taxpayers' dollars. And I do think that our entry is a good idea, it's a good example of federalism, because we really believe in the power and the ideas and the innovation that come from the states. Washington doesn't have the solutions. We've both spent our careers there, and we absolutely know that Washington doesn't have the answers. So we Bob and I were invited by the Bush administration to serve on the Federal Medicaid Commission. So you have this program providing health care to now, paying for health care for now more than 50 million Americans. And it really hasn't been changed significantly for the last 40 years. And when you look at the program, you see that people who are dually eligible for both Medicaid, the program for lower income Americans, and Medicare, primarily for senior citizens, that this overlap of people are often the oldest, the sickest, the most needy, and often with the largest number of health problems. And yet they were getting the worst care and costing the most money. That is clearly a place to start with policy solutions. And as our commission went around the country looking at examples of what was happening in other states, it was clear to us that there were so many good ideas in the states, and yet they were blocked by tens of thousands of pages of rules and regulation that they had to go through in this Mother May I program to get permission from Washington to fix these programs and to provide better care for people who are falling through the cracks of the system. In Massachusetts, the 9 million dual eligibles take up about 15% of the patient population, but 40% of the costs. And that's also true here in Massachusetts. So what can we do to solve that? We need to get power and control back to the states so that states can solve this problem. Washington clearly can't do it. After 40 years of trying, you begin to think maybe we need to try something different. And so our commission offered as its really major recommendation, a program called Medicaid Advantage, to again devolve power and control to the states so that they have greater control over the financing, to come up with the kinds of solutions that work for their patient populations. And this idea was accepted by the, as I said, by the Medicaid Commission. Report printed, and sometimes all these reports do is gather dust on a shelf. But this one of our commission members, was Melanie Bella, really became very interested in this idea. And she is now the director of the federal Medicare and Medicaid Coordinating Office, in charge of putting together programs and solutions for dual eligibles. And it's now federal law that the states have more flexibility. And Massachusetts was the first state to apply for the flexibility, the program flexibility, to be able to do a better job of providing care for dual eligibles. And so it comes full circle from the commission, from the problem to the federal commission saying, we need to give more power to the states, to Massachusetts stepping up, and the Pioneer Institute seeing all along that, yes, we know that we can take more leadership, we can provide guidance to the state if we have more control over those dollars so that we can do a better job of taking care of patients. So I congratulate all of you at that supporting the Pioneer Institute, working for the Pioneer Institute, all that you've done. Josh Aschenbach is really a wonderful leader not only in Massachusetts, but really a thinker who's providing ideas for all other states as well, in helping them to see how can we solve this problem. It's got to get down to the local level. And we are extremely grateful to you for this award and for all you are doing to support moving power and control back to the states, and for the ideas that will allow that to happen. And I'd like to ask Bob Helms, my colleague, who's really he is the guru of health policy in Washington. He has worked for so many years in both inside, outside government, in the think tank world, and he really is the person all of us look to for ideas and for insights into how to get public policy back on the right track so that limited government and individual freedom can be at the center. Bob.
I'll be brief, but I first was going to thank the Pioneer Institute, but I've got to thank Grace Marie for her remarks. But I also want to thank Grace Marie for doing all the hard work on this proposal. I was in the Reagan administration at HHS, and we were, in that time, pushing federalism and regulatory reform. And when we proposed a number of block grant proposals, some of you remember, and when the Congress wouldn't go along with those, we fought some of the same battles in the regulatory front, and we had some successes. So promoting federalism was something I think that came naturally to me at that time. But in the Medicaid Commission, we saw lots of evidence that this population was being ill-served by the program, and that a lot of states had a lot of good ideas about how to improve care. And that was what I think motivated us. I want to thank not only the Pioneer Institute, but the people who support it. I especially want to thank the judges, Dick and your team, because for your extremely good insight, you know. But after seeing the competition, I'm even more surprised that we've got this thing, because there are lots of good ideas in public policy. But my whole career, mostly in Washington, has been at AEI, a think tank. And I want to tell you, I'm really looking forward to Michael's remarks. I've been away, and I want to see what he has to say now, since I haven't been around the AEI lunch table to hear what he's been saying, which is something I do on a regular basis. But I'm discouraged about the health policy debate today, the tone that is taken in the election and so on. But I can say the message here, I think, is for think tanks, whatever happens in this election, these issues are not going away. And it means that think tanks like AEI and Galen and Pioneer have a real job to do in the future to keep going with this careful, factual, good analysis of programs. I think in the end, politicians can't keep ignoring reality, and you've got to keep telling that story. So thank you, Pioneer, on all of you, in particular the people who support think tanks like this. Thank you.